Now we're performing an intra-op endoscopy after the completion of the sleeve gastrectomy. This is the upper portion of the esophagus. We're going down. We don't see any mucosal injuries, no lacerations, no blood. We're advancing the scope. This is mid-esophagus. Again, there's no issues, no lacerations, no erosions. Lower esophagus. This is GE junction. You can see the Z line. This is squamous cells, columnar cells of the esophagus. We're going inside the sleeve. That's the staple line. There's no evidence of bleeding. There's some red spots here, cherry red spots, basically mucosal erythema, probably secondary to the suction applied to the tube with the fenestrations. Those are what we call hickeys of the inner lining of the stomach. They have no clinical significance and no clinical implications whatsoever. They're usually very mild, very superficial. As you can see, they're not causing any bleeding. All the way down to the pylorus. Again, there's few spots here. Very superficial, very mild. This is what you usually see with gastritis or mucosal gastric erosion. So again, they're very mild and they'll probably get better on their own. You don't need to do anything special about them. That's pylorus. I'm going to check with my partner to make sure there's no leak, no bleeding. We're going to suction and we're going to pull back very slowly. So a few things we look for when we do an upper endoscopy after a sleeve. One of them is to make sure there's no bleeding. Obviously you can see the staple line is hemostatic. And then the other thing you look for is to make sure that the sleeve is straight. There's no evidence of stenosis, which is the case here. And also you check for leak to make sure there's no leakage, which is also the case here. So this is a normal upper endoscopy. Thank you.